Hello, I'm Dr. Parveen Kaur, an infectious disease specialist for the tuberculosis program at the City of Pasadena Public Health Department. On the occasion of World TB Day this year, I want to bring awareness to latent tuberculosis infection, also called TB infection or Dormant TB, and highlight the importance of preventative treatment. Latent TB or TB infection is the stage before active TB disease. It means that people have been infected by the TB bacteria but have no signs or symptoms of TB disease. People with latent TB have a 5 to 10% lifetime risk of progression to TB disease in the future. This risk is higher in people with compromised immune systems, such as living with HIV, malnutrition, or diabetes, and people who use tobacco. According to the World Health Organization, about 1/4 of the world's population, or 2 billion people, are infected with the TB bacteria, with more than 10 million becoming ill with active TB disease each year. In the United States alone, there are approximately 10 to 15 million people infected with tuberculosis. People with this latent TB infection are not contagious and cannot spread TB to others. But this is a big reservoir of people who are at risk for developing active TB disease. And it is important to note that of all the active TB cases in the United States, as many as 80% are due to reactivation of untreated latent TB infection. Most of you would know that tuberculosis disease is treatable, in fact curable if treated correctly. But did you know that it is also preventable? In the US, there is a dual approach to address tuberculosis by the Centers for Disease Control and Prevention and the local public health departments. Firstly, we find and treat active TB disease cases, and secondly, we also test for and treat latent TB infection to prevent progression to active disease. There are two ways to test. The first is a skin test that most of you are familiar with, and the second way is a blood test, which is easier to do. It can be more accurate and does not need a reading in 48 to 72 hours. Now let's talk about prevention. It is important to recognize that preventative treatment is an established concept in the management of infectious and communicable diseases. And this applies to latent TB as well. There are several preventative treatment options available to treat latent TB infection and stop the progression to active TB disease. Earlier antibiotic regimens were used for a duration of 6 to 9 months, but now we have options with much shorter periods of time, some as short as only 12 weeks. Preventing active TB by treating TB infection is the cornerstone of TB elimination in the US and the world. All healthcare providers should pay attention to TB screenings, especially primary care providers. They are at the front line of patient care in the United States and should make TB testing a routine part of primary care, especially for patients at higher risk of TB disease. This includes people from countries where TB is common, healthcare personnel working in high-risk settings like correction facilities, nursing homes, homeless shelters, and hospitals. It also includes children under 4 years of age or those exposed to adults in high-risk categories. Expanded testing and treatment for latent TB infection, better diagnostics, and strong partnerships, both domestic and global, are needed to turn TB elimination into a reality. Thus, treatment of latent TB infection is an important part towards the World Health Organization goal to end the global TB epidemic by 2030. Thank you.